In this video, we are going to study the structures which are related to the parotid gland. The parotid gland lies here just below the ear and it is surrounded by a capsule. The capsule is derived from the deep fascia of the neck. The outermost layer of the deep fascia of the neck is called the investing layer. It surrounds the neck like a collar. This white structure, the collar which we use usually for the patients who have some kind of neck injury. This white structure is the investing layer of deep cervical fascia and it is obscured in this area by the platysma which lies in the superficial fascia. So if we remove this platysma, you can see this white structure going all the way around the neck. Now, when this white layer, the investing layer of deep cervical fascia, reaches this the part of the parotid, it splits into two parts: a superficial lamina, which covers the superficial surface of the parotid gland and reaches the lower limit of the zygomatic arch and gets its attachment there. The deep lamina passes deep to the parotid gland and it gets its attachment to the angle of the mandible and the styloid process. The superior attachment of the investing layer of deep cervical fascia is at the boundary of the head and the neck. You are looking at the posterior aspect of the skull. This is the occipital bone, this is the lambdoid suture. This structure here is the external occipital protuberance, and these are the superior knuckle lines. So these lines, the superior knuckle lines and the external occipital protuberance, mark the boundary between the head and the neck posteriorly. So the investing layer of deep cervical fascia starts its attachment from here, from the knuckle lines, the external occipital protuberance, the other knuckle lines, superior knuckle lines, and when it comes on the lateral aspect, it gets its attachment to the mastoid process, then to the styloid process, and then it comes to the angle of the mandible. From here, it moves all around the base of the mandible and goes back to the other side, making the same attachments. Now this is the point between the mastoid process and angle of mandible. This is the place where the lamina, the deep cervical fascia, splits into two parts. The outer lamina, which comes up here, covers the parotid gland from the superficial aspect and gets attached to the lower part of the zygomatic arch. And the deep lamina moves inwards, reaches the styloid process and stops here. So it has a free margin between the styloid process and the angle of mandible. After this, this fascia ends. It does not move forward. So the part between the styloid process and the angle of mandible is called the stylomandibular ligament. So that means the stylomandibular ligament will be on the posteromedial aspect of the parotid gland and the superficial lamina is covering the whole of the lateral or the superficial aspect of the parotid gland. Now, these are some major structures which are related to the parotid gland. First, we will see the names of these. After this, I will tell you the structures related to individual surfaces and borders of the parotid gland. This is the superior aspect or the base of the parotid gland. This is the apex of the parotid gland. This is the anterior border and this is the posterior border. So, to the base of the parotid gland, this nerve is the auriculotemporal nerve. The name tells that it will supply the auricle or the pinna, which is somewhere over here, and the temporal region. So this is the auriculotemporal nerve, which is a branch of the mandibular nerve, which itself is a branch of trigeminal nerve. Then comes this red colored structure, which is the artery. This is the superficial temporal artery. It is one of the terminal branches of external carotid artery. The other terminal branch is the maxillary artery, which you cannot see over here because it lies on the deeper aspect of the gland. This is the superficial temporal vein and it joins another vein which is called the maxillary vein, which is not seen here, and both of them join to form the retromandibular vein. The retromandibular vein passes through the surface or through the substance of the parotid gland and it splits into two parts with the anterior division and a posterior division which exit the apex of the parotid gland. This is the anterior division of retromandibular vein, this is the posterior division of retromandibular vein, and this is the external carotid artery which will enter the parotid gland and split into two parts, the superficial temporal artery and the maxillary artery, which is not seen here. These two structures, this artery, the red one, is the transverse facial artery, which is a branch of this artery, the superficial temporal artery. This artery arises within the substance of the gland and then exits through the anteromedial surface. And the other vein is the blue colored structure is the transverse facial vein, which drains into the superficial temporal vein within the substance of the parotid gland. This structure, the orange structure, is the parotid duct. It starts from the anterior border of the parotid gland, goes over the masseter muscle. After that, it dips downwards, dips inwards, and opens in pierces the buccinator muscle, which is not shown here, and it will open into the oral mucosa opposite the second molar tooth. This is the first molar tooth. This is the second, and the third one is behind. So it opens opposite the second molar tooth. After that, these yellow structures are the branches of the facial nerve. The facial nerve exits the skull from the stylomastoid foramen. This is the mastoid process. This one. This is the styloid process, and between these two is this opening, which is called the stylomastoid foramen. This small foramen is called the stylomastoid. So here I have attached a nerve, so you can see the foramen. Between the mastoid process and the styloid process is the stylomastoid foramen, from which the facial nerve arises. Then it enters the gland through the posteromedial surface and splits into its branches, which emerge from the anterior border. Basically, they emerge from the anteromedial surface, but because you cannot see this surface over here, you can see the nerves emerging from the anterior border. It has five branches. One branch goes towards the temporal region. This is called the temporal branch. The other goes towards the zygomatic bone. This is the zygomatic branch. Then comes a buccal branch. The buccal branch splits into two, upper buccal and a lower buccal. The upper buccal lies over the superior to the parotid duct, and the lower buccal lies inferior to the parotid duct. Then comes the marginal mandibular, which reaches the margin of the mandible, and then the cervical branch, which reaches the neck. Now we will study the relations of different aspects of the parotid gland, the individual aspects of the parotid gland, starting from the base or the superior surface. This is the superior surface of the parotid gland. The visible structures which are related to the superior surface are the superficial temporal vein, the superficial temporal artery, and the auriculotemporal nerve. Now, this opening is the external acoustic meatus. The external acoustic meatus has two parts, a bony part and a cartilaginous part. As the soft parts have been removed from this skull, the cartilaginous part is also removed. The cartilaginous part eventually expands to form the pinna or the auricle of the ear. So, this superior surface of the parotid gland is also related to the cartilaginous part of the external acoustic meatus. Now, coming to the superficial surface of the parotid gland, from outside to inside, if we the first thing which you will see on a face is the skin. If you remove the skin, after that you will see the superficial fascia. The superficial fascia in case of a parotid gland contains this muscle, which is called the platysma. It also covers part of the parotid gland, so it will come into the superficial relations of the parotid gland. So first of all is the skin, then comes the superficial fascia containing the platysma, and this superficial fascia also contain a set of lymph nodes which are called the superficial parotid lymph nodes, which are not seen in this diagram. They will be located somewhere over here in within the superficial fascia. Then the superficial fascia also has a branch of the great auricular nerve. The great auricular nerve is the a branch from the cervical plexus, and it supplies the area of skin over the angle of the mandible. So as the parotid gland is lying near the angle of mandible, the great auricular nerve lies in the superficial fascia over the parotid gland. So the structures within the superficial fascia are the uh, platysma, the superficial parotid lymph nodes, and a branch from the great auricular nerve. Deep to the superficial fascia comes the deep fascia, which we have already mentioned. The deep fascia in this case is coming from the investing layer of the deep cervical fascia, and it forms the capsule of the parotid gland. It is tightly adherent to the superficial surface of the parotid gland. So the deep fascia or the capsule of the external lamina of the capsule of the parotid gland covers the superficial surface of the parotid gland and gets attached to the inferior surface of the zygomatic arch. And if you remove the deep fascia, you will find some lymph nodes which are called the deep parotid lymph nodes, and they are embedded within the substance of the gland. So again, from outside to inside, first of all you will see the skin, then comes the superficial fascia, the superficial fascia containing the platysma, the branch of the great auricular nerve, and the superficial parotid lymph nodes. After removing the superficial fascia, you will see this structure which is called the deep fascia, and it is forming the capsule of the parotid gland. And after removing the deep fascia, you will see the deep parotid lymph nodes. So these are the relations of the superficial surface of the parotid gland. Now, to understand the relations of the anteromedial surface of the parotid gland, we come back to this diagram in which this is the anterior border and this is the medial border of the parotid gland. So the area between the anterior and medial borders, this is the anteromedial surface of the parotid gland. So the structures which are related to it are the posterior border of the ramus of mandible, the the masseter muscle, and the medial pterygoid muscle. And this is the facial nerve entering through the posteromedial surface, passes through the gland, and its branches emerge from the anteromedial surface. So they are also partly related to the anteromedial surface of the gland. Now coming to the skull, we will see this same diagram over here. This is the anterior border of the parotid gland. This is the anterior border of the parotid gland, which in this diagram is shown over here. This is the medial border of the parotid gland, which in this diagram is shown over here. So the area between the anterior and medial border, this is the anteromedial surface, which is obscured by the mandible, posterior border of the mandible. So if you see, the anteromedial surface is related to the posterior border of the mandible, which in this diagram is this black structure, and the masseter muscle on the outside. In this diagram, this is the masseter muscle, and the medial pterygoid muscle on the inside. In this diagram, this is the medial pterygoid muscle. Now we will remove this parotid to see the relations of the anteromedial surface in this structure. Now this is the anteromedial surface, which was related to the posterior border of the ramus of the mandible and to the temporomandibular joint. This is the condyle of the mandible, making the joint with the temporal bone called the temporomandibular joint. So if we invert the skull, this whole structure is related to the parotid gland, the posterior border of the ramus of mandible, the neck of mandible, and the temporomandibular joint. These two muscles, the masseter and the medial pterygoid muscle. Now this is the gland which we have removed from this surface, like this. It was here, we have removed it like this, and you can see that this is the anterior border and this is the medial border, and this is the anteromedial surface from which the branches of the facial nerve are emerging. This is the posteromedial surface. This surface is the posteromedial surface, and it is related to the facial nerve, and the external carotid artery enters this surface, and the posterior branch of the retromandibular vein emerges through this surface. Now we will again compare this parotid to this diagram. This is the posterior border and this is the medial border. In this parotid, this is the posterior border, and on the inner aspect, this is the medial border of the parotid gland. So this surface is the posteromedial surface, and this surface is related posteriorly to the mastoid process. Look at this. This is the mastoid process, and in this diagram, this is the mastoid process. This is the styloid process, And in this diagram, this is the styloid process which is lying near the medial border. So these are the posterior relations of the parotid gland, and because the soft tissues are not attached to this mastoid and the styloid process, you can say the muscles which are attached to the mastoid and styloid process also are related to the posteromedial surface of the parotid gland.